This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. We have an awesome episode for you today. It's titled Specific Strategies to Do More High-Value Dentistry. This is a topic I think you'll all be able to apply in your practices, and I think you'll find it very useful. Before we get to that podcast episode, two announcements. Coming up shortly after the airing of this episode, we have our next Thriving Dentist Masterclass. This is coming up on July 27th, and the title of that masterclass is 6 Steps to Successfully Resign from PPO Plans. A masterclass is a 3-hour course done in one evening. It's done virtually, so you can attend from the comfort and convenience of your home or office. However, we do it live, so you can interact with me and ask questions. So it's a live stream, 3-hour course. You get 3 hours of CE credit. It allows me to take a deep dive into a particular topic. And of course, by virtue of that title, you'll know that that episode is all about the 6-step plan to successfully reduce your insurance dependence. If you're ready to start that journey, that would be a great episode for you. If you're not sure if your practice is the right practice to look at reducing insurance dependence, come to that masterclass and we can kind of walk you through that. And maybe you just want to peek under the tent, see what it's all about. Come join. Very inexpensive, less than $100. You get 3 hours of CE credits. And I will provide in that episode, quite literally, a blueprint for you to follow to successfully resign from PPO plans. And if you choose to take that journey, that may be the most important strategic decision you ever make. You can register for that by going to thrivingdentist.com/masterclass. Come join us. July 27th, 7 to 10 p.m. Eastern Time. Now, the next announcement I have is we have a guest contributor in the form of Dr. George Schmidt. George is going to provide a great tip for you if you're placing implants. He's going to provide a great tip, and he's going to answer the question, do you need a 3D scan, a 3D cone beam scan to place implants? Well, I'm going to let George answer that question because he answers it brilliantly. Now, with no further ado, Dr. George Schmidt.
Hi, my name is Dr. George Schmidt, and here's a clinical tip for all you thriving dentists out there. You know, in addition to private practice and being the host of the AGD podcast series, I teach surgical placement and restoration of dental implants at NYU College of Dentistry. And oftentimes we're asked, do I really need a scan prior to placing an implant? And do I really need one of these machines in my office? And every time I say, absolutely. If you're going to practice implant dentistry, you must have this technology. Why is that? For surgical placement, of course, you want to put that implant precisely where you want it. We want the proper position. We want the proper angle. We need to know the surrounding structures. We need to know the patient's anatomy. We need to know the anatomical limitations. Not to mention, this will allow for guided surgery. And you know what? You might need a scan during surgery, and you might need a post-op scan, and you must have this technology to be able to do that. But what about the doc that doesn't place implants? Well, if you're going to treatment plan implants for your patient, as we all know, implants are prosthetically driven. So at the treatment planning stage, you need to get involved, and you need to be able to tell your surgeon exactly where you want that implant so you can have the best opportunity for clinical success. What about endo? I would argue any tooth that you're going to perform endodontic treatment on, other than a maxillary central incisor, you need to take a scan before you start. Why is that? Because you need to know how many canals there are, where the canals are, and if you can actually find them before you spend an hour of your time, an hour of chair time, and an hour of your patient's time looking for that canal. If you can't do the treatment, very simple, you can email the scan, you can burn a disc and send it off to your specialist. It's very simple. What about oral surgery? What about oral pathology? Well, that's simple and that's self-explanatory. So is CBC technology the gold standard? Is it the standard of care? It's not the standard of care, but it should be your standard of care. So what's the clinical tip for the day? Scan and plan. We'll see you next time.
Welcome back to the Thriving Dentist Coaching and Action segment. Before we jump into the coaching and action segment, I want to take a minute to thank Dr. George Schmidt for that awesome, wonderful tip. I think this is one of those tips that I think is very relevant to even our podcast today, and also a lot of people would appreciate because Dr. Schmidt has decades of experience, so he knows what he's talking about. The coaching and action segment today is specific strategies to do more high-value dentistry, specific strategies to do more high-value dentistry. It's a great topic because I think we live in a time where working smart comes with a more premium, more benefit to the practice owner. And as the pressure on costs keep going up, one of the ways you can go on the offense is to grow the high-value part of your practice. And Gary is a proponent of this. I'm sure those of you who have been listening to the Thriving Dentist podcast series over the last few years know this. So Gary's going to share very specific strategies on how you can do that. And he's going to kind of, open the curtain a little bit and share some of the things that he has been testing with his clients. And hopefully you can also benefit from it. Gary, let's jump right in.
Yeah, let's start by defining high-value dentistry, Naren. I think to some degree, anything we do for a patient could be perceived as being very valuable, to patient. Or oral health is priceless, and anything we do could be considered having high value. But I'm talking specifically about what we might consider more advanced clinical services. I have just put a name on them called, collectively called high-value dentistry. Now, all of our listeners know the name of this podcast. It's called The Thriving Dentist Show. And I've often been asked, what does it mean to have a thriving practice? And my answer to that is you have a practice that provides personal, professional, and financial satisfaction. Personal satisfaction means you're taking care of people you enjoy, surrounded by a team you love. Professional satisfaction means you're doing more of the kind of dentistry you like to do, whatever that is. Whatever it is that you like to do, you get to do more of it because now you're doing something you like. And then financial satisfaction is a little more self-explanatory. It simply means that you're being rewarded fairly and handsomely for your care, skill, and judgment. But really, it's that second component, the professional satisfaction, doing more of the kind of dentistry that you like to do. Now, there are dentists that really enjoy doing, the full gamut of everyday general dentistry. They really enjoy that. That's fantastic. You find your sweet spot. You find what it is that you enjoy. But many dentists also enjoy doing what would be considered more advanced services, things like placing and restoring implants. Now, before I list this menu out, Naren, I want to emphasize that this menu isn't meant to be, a definitive guide of what you should do for high-value services, because the real key to adding high-value services in your practice is doing services that you enjoy doing, that you like to do. If you don't like doing it, then don't do it. I learned that lesson. In fact, it was really brought home to me the second time I read the book, Good to Great by Jim Collins. I missed it the first time. I don't mind admitting that. I missed it the first time, but I got it the second time. In the book, Jim Collins talks about, something all of us know about. And that's the importance of intention and having a to-do list, We all know about that, right?
Yes.
We have a list of things we need to accomplish, and it's, and it's intentional, it's focused, it's intentional. But Jim Collins makes the point in the book that every time you do a to-do list, you should have a parallel list that you do at the same time of a stop-doing list, so that you can free up time. You can create a void to do more of what it is that you want to do. Does that make sense, Naren?
Yes.
Now, I doubt that very many of our listeners have a stop doing list. I doubt that very many humans have a stop doing list. But there's a thought, right? Because otherwise we're going to be so busy doing what we're always doing that we don't have room to do what we want to do more of. So a stop doing list can be a very important strategic approach. So I'm not going to, give you the chiseled in stone list of what you should do for high value services. You got to pick the things you like. But for example, it could be things like this: placing and restoring dental implants. It could be adult orthodontics. It could be doing more cosmetic dentistry. Now, cosmetic dentistry, Naren, could be a lot of things, but I tend to think of cosmetic dentistry as what we call an 8 or 10 unit smile design case with lab fabricated porcelain veneers. That would be, kind of the one of the areas that falls under cosmetic dentistry. Maybe you're in an area where there is an older population, like we are in Arizona, where there's a segment of the population is older. And as a result of that, they have much more complex restorative dental needs. Maybe you get to a point where you're doing full mouth restorative dentistry. Maybe it's diagnosing and treating obstructive sleep apnea with appliance therapy. Maybe I'll go a different direction here. Maybe you have an interest in doing the ankylosing procedure. That's the lip and tongue tie release, releasing the frenum with the laser so that an infant can nurse. And maybe that's an area that you would like to do more of in your practice. I would certainly consider that to be high value dentistry. Now, I've introduced that service to clients and thrown out there as an idea. And I've had some clients say, "Oh my gosh, that fits my practice like a glove. That I would love doing that. I have competency with the laser and I'll do some more CE around it, but hey, I'd love to do that." And then I've had other clients say, "Gary, no offense, but I'd rather slam my head in the car door than do that." And you know what? Guess what? Don't do that then. That's not a good thing for you to do. So that's a good example of kind of polarizing extremes. I think when any of our listeners, when I mention ankylosing, you all know what that is. Any of our listeners are going to think yes or no immediately. Whatever your predilection is there, follow that path. If it's yes, then go for it. If it's no, then put it aside.
So what you're saying is do what you love.
Do what you love.
Yeah.
Yeah, because if you do what you love, two things are going to happen. You're going to have fun. You're going to enjoy it because you enjoy doing it. Yeah. And secondly, you're probably going to be really good at it because you enjoy taking massive CE. The idea, you get excited, maybe it's a course that's coming up in 3 months and you literally can't wait, to go to that course. And so, you enjoy it and you really love it.
The opposite of that is doing something because somebody else is doing it, doing something because you think you have to do it.
Yeah.
You're not a fan of that.
No, not at all. Not at all. It's a path that leads to disappointment and discouragement. Find what it is that you love. And I'll introduce what I would call a high value service. It's often very overlooked. And that's oral conscious sedation. Oral conscious sedation. Now, I know some of our listeners scratching their head, say, that's a high value service? It certainly can be. First of all, there's a large segment of the population, 49% of the adults in the United States put off a visit to the dentist because of fear. And if we could provide, oral conscious sedation to make every visit a comfortable experience, has tremendous appeal to people. There's also a correlation on that particular high value service. People that are afraid of the dentist typically haven't been to the dentist in a long time. And I'm talking a long time. I'm not talking about, they're overdue for their hygiene visit. I'm talking about having been to the dentist in 15 years, 20 years, 25 years. And very often those patients need a lot of dentistry to essentially deferred maintenance, things they haven't, things that have just kind of deteriorated over the years because of no professional care. And we have a client, we've tracked this in one of our clients. We actually track this in many of our clients, but one comes to mind where his average case for oral conscious sedation is between $7,000 and $8,000, $7,000 and $8,000. It's not particularly exotic dentistry. It's fillings, root canals, and crowns, but it's a lot of it because of the needs of that patient. And it's a great experience for the patient because they're completely comfortable. If any of our listeners are interested in CE for oral conscious sedation, I highly recommend the DOCS organization, DOCS, Dental Organization for Conscious Sedation. That was one of the first courses that Paul took out of dental school to advance his education. And I highly recommend it. Michael Silverman is the founder of Docs. Brilliant. He's a great friend of the podcast. I've had him on many times. In fact, if you'd like to hear more from Michael, just go search Thriving Dentist Show and type in Michael Silverman. You'll hear some great interviews that I did with him. Himself and his team, they're absolutely amazing. You can go as deep as you want on it. And, even if all you do is level 1 anxiolysis, it's a great service for your patients. And a great addition to your practice. And level 1 anxiolysis would be nothing exotic. It would be, delivering triazolam, single dose, no multi-dose, no cocktailing, but it could allow you to make the visit a really comfortable experience for your patient. Highly recommend DOCS. Take a look at that. Well, you have to decide what your high value services are. But then when we go from there, we've got to talk about how do you attract these cases to your practice. And what I'm going to say, I'm going to speak to the obvious first, Naren, and that is for every one of the high value services that I've mentioned, it's likely that you already have patients in your practice that could benefit from those services. It's likely you already have them in the practice.
Yes.
And I would start there because that's the low fruit on the tree, for sure. But the biggest point I want to make about this is that you have to develop your confidence in delivering those services. And that for some, you could just click your fingers and develop that confidence. But I would say that group of dentists is definitely in the minority. And it's one of those catch-22s. Naren, I remember the first time that I went to a bank to get a loan.
Yes.
I was very early in my career. And I prepared a business plan. I prepared a financial statement. I went in to the banker, and basically he said, well, Gary, if you can pledge enough assets to cover this loan, we would give you the loan. And I'm thinking in my head, if I had enough assets that would cover the loan, I wouldn't need your money. Right? Kind of a catch-22. If you have the money, we'll give you the loan. Well, if you don't have the money, then we won't give you the loan. And so how do you get some experience when this might be one of your early cases? How do you do this? It's probably a thought that stops a lot of doctors in their tracks, right? Well, let me make a suggestion. This is something, some of you will know that I had the privilege of being an instructor in the PAC Live program, Pacific Aesthetic Continuum program, where dentists would bring a patient, do a 10-unit upper anterior porcelain veneer case. Dr. Hornbrook was the director, brilliant resource in cosmetic dentistry. And over 2 weekends, first weekend they'd prep and temporize the case, and then the next weekend they'd seat the case. And many of those doctors that attended that course would have a great experience with that patient in the course, but they'd reach out to me about a year later and say, Gary, that PAC Live was a brilliant course, but I haven't been able to get traction in my practice. And I want to, before these skills atrophy and I forget everything I learned there, I need to start doing some cases. And I would say, pick 2 cases in your practice, pick 2 cases. And let's do those. So this would be an 8 or 10 unit upper anterior porcelain veneer case. And pick a patient that could benefit from it, but maybe doesn't have the financial resources to pay for it, and offer them a deal. And maybe you do it for lab fee only, or 50% savings. And do that on an off day. Do that case on an off day. If you don't work Fridays, do the case on a Friday. Bring your assistant in. Now you're not going to have the pressure of doing this in the day-to-day practice. And you're going to be able to do it at your leisure. It'll be a great experience for the patient. The other key in picking a patient on this one, Darren, is pick a patient that is going to be a billboard for you, a walking billboard. Someone that's outgoing, someone that's social, someone that's gregarious, someone that has contact with other people. This probably isn't Bubba, who does the graveyard shift at the ball bearing factory, because he may be social, but he's asleep during the day because he works the graveyard shift. Maybe you pick a young school teacher. Maybe you pick someone that is in real estate and they like to improve their appearance. Someone that works in some customer-facing business that would like to improve their appearance. But maybe for whatever reason, they don't have the resources to do this. Offer to do it as a special savings. And now you're going to have a couple of cases under your belt. Each case is going to radically improve your confidence. And now you'll be ready for prime time. Maybe you have to do a few of those. Maybe there's a team member. Maybe there's a family member. Think about that, Naren.
Yes.
Pretty
We all
cool, huh?
Think of somebody, right, in our circle.
Yeah, think of someone in your circle that you could help with this. Once you do that, you're going to want to get serious about marketing. And the best way to do that is to really master search engine optimization. Specifically, all the keywords and all the key phrases around each one of those specific high-value services.
Correct.
And by the way, and as you know, Naren, I'm now in your territory about this. The keywords and phrases say around dental implants. I'm just randomly picking one.
Right.
Those could number in the hundreds.
Correct.
Perhaps even thousands.
Yes.
Right. And so we can learn in your area what are the most common phrases and keywords and key phrases that people use to search for a solution for a missing tooth. Or maybe you want to market a particular type, but maybe you want to do more all on X cases by replacing a floppy lower denture with 4 or 6 implants that would be perhaps screw retained. You could remove it for cleaning or repair, but as far as the patient's concerned, it's fixed. And there's specific ways that you can learn what the keywords and phrases are that people use in your community to do that. And then you enhance your website with those keywords and phrases, not only in the copy of the website, but in the coding behind the curtain, in the HTML coding behind the curtain that comes into play when it comes to Google presenting you as a solution for those services.
Yeah, you want to like dominate, right? Like in the case of LifeSmiles, for example, many of these high value services, there are 30, 40, 50, 100 different keywords. Whatever you type in, LifeSmiles shows up again and again and again and again. That's what you want. You want to dominate your city with 500, 300 dentists. And the more you dominate it, the better you are going to do, in terms of your practice.
Yeah, the goal is to get on page 1.
Yes.
Organically. Let me emphasize organic. You could instantly get on page 1 by paying Google.
Yes.
But the problem, there might be 2 problems with that. You may not have the resources to pay Google enough to really create that traction.
Yes, you probably have like $100,000 a month budget, probably.
Yeah. And secondly, we know from data that a paid ad is, well, let me put it the other way. An organic find, when someone finds you organically, it's 5 times more valuable than if someone finds you by a paid ad. So much better to have people find you organically, meaning you didn't pay, you earned that position on page 1.
Right. They trust you. It's like, a professor that you are paying to go listen to versus somebody who paid to for you to listen to them. Who are you going to trust, right? You're going to
and we also know, just another statistic, I think I have this right, Naren, but I believe that when someone lands on your website from an organic citation,
Correct.
They spend, is it 5 or 6 times the amount of time on your website?
Yes, 6 times more time.
6x. Yes. So if someone, if they find you by an ad, how much time, you have the data on this, Naren, how much time when someone finds you by an ad, I'm talking about pay-per-click or what's called a sponsored or paid ad, right. How long does that individual statistically say on your website?
Yes, the average time spent by someone who finds you through a Google ad or paid ad, like you explained, Gary, is 15 seconds.
Okay, pause that, Naren. I want everyone to hear that.
Right.
You said 15 seconds.
That is correct.
Now, I know that every one of our listeners is in denial right now. Everyone listens in, no, not mine. No. When my patients land on the website, when my potential patients land on the website, they spend time. That website is so interesting to them that they spend a massive amount of time on that website. Naren, is my sarcasm coming out at all?
It is.
Because no, they spend 15 seconds, 15 seconds.
15. The reason they spend only 15 seconds is they see that word sponsored listing or paid ad before they click on it. So they're clicking with doubt. So almost like I have 1 foot in the door, but I have one
I'm
foot.
Curious, but I'm suspicious.
Yeah, suspicious.
Now, on the other hand,
that triggers them, they're out. Like
6x. 6x. 15 seconds for a paid ad.
Yes.
If I run the math on that, they spend 1.5 minutes then on your website. I think we'd all agree we'd rather have the patient spend a minute and a half than 15
Yes, if they come
seconds.
to organic, they're going to spend a minute and a half.
Yeah, minute and a half. That still isn't the hours that our listeners fantasize that people spend on the website. And I'm going to raise my hand and say, I thought the same thing. I thought that we could create such a compelling website that people would, I never thought they'd spend hours, but I thought they might. I thought when we did the research and discovered, how long people stay, I thought it might be 10 or 12 or 15 minutes. It wasn't anywhere near that.
Right.
So anyway, new information maybe for some of our listeners. Well, as we come to the end of the coaching and action segment, the takeaways for you is it's really about having an intentional practice. Intention, where you do more of what it is that you want to do. And it really takes you down a whole path, takes you down to a CE path. Maybe I'm inspiring you to really reach the pinnacle of the credentialing that you could do. Maybe you become, you earn a fellowship in the AGD, a mastership in the AGD. Maybe you become accredited by the AACD. Maybe you earn fellowships in an implant society. But you really want to achieve that pinnacle, because guess what all of that CE is going to do in terms of your confidence? It's going to build it to where you can, when you talk to patients just feel the confidence that you have in terms of being able to help them with whatever service that is. I want to encourage all of our listeners to add more high-value services. We've got some questions coming up that will kind of get into a little bit more granular detail about how to, but hopefully we sparked some interest up till now.
Gary, I very much enjoyed our coaching and action segment today. Specific strategies to do more high-value dentistry. I have 4 questions for you. Let me start with the very first question, and it's a wonderful question. I'm interested in learning more about placing dental implants. Can you suggest some CE resources?
What a great question. Yes. And first of all, I think the pathway to really developing confidence and competency around these high value services is just to push the envelope on the CE. Take as much CE as you possibly can. Every time you move along that path, your confidence goes up, your competency goes up, and it enhances your practice in so many ways. I'm a big fan of Implant Pathway. Implant Pathway, if you Google that, is a great CE program put on by Justin Moody, Dr. Justin Moody. Justin is a general dentist that is basically an implantologist. And he's placed, I don't even know how many implants, but it's a crazy high number of implants. His program is awesome. It's here in Phoenix, and there's different options, but one of the options is a year-long, continuum that you would attend, where it's 4 different weekends over the year, and towards the end of that program, you'd actually be placing implants along with the instructors at Implant Pathway on homeless veterans that have been pre-screened by a social service agency. They're healthy, they're sober, they're healthy, and they're living in shelters, and they often have some serious dental issues. They are your patients for this. There's another group of dentists that come later on that provide the restorations, but you would be placing the implants. Great way to do get a lot of experience in a very concentrated period of time. Justin, I think the world of him, and his colleagues that teach with him. They're fantastic. They have a beautiful center here in Phoenix. That is the location for that. So Implant Pathway, I'd put it high on your list. Another is the Mish Institute. Sadly, we lost Carl a number of years ago. Just a real innovator and leader in dental implants. However, the Mish Institute continues. And the Mish Institute would be considered I would consider another great place to go for dental implant education. Another would be my friend, Dr. Arun Garg. Arun has a number of courses available in dental implants, even live patient courses offshore. I believe they're in the Dominican Republic. You'll notice that some of these courses are in places, outside of the U.S. For example, there's a number of these programs in Mexico, specifically Tijuana. border town, just south of San Diego. And the reasons these courses are there is that it can be difficult to do live patient courses in the United States because in the state, some states, the dentists, if you're traveling to that state to take the course, you have to have the license from that state, a dental license from that state, if you're going to be doing live patient care. So that's why a number of these programs are located offshore, because they don't have those regulations. So there's courses in Mexico. I believe Arun is in Dominican Republic. I've seen other countries where these types of courses are hosted as well. Now, Justin Moody is in the United States. He was able to do that, and he was able to get special status by the Arizona State Board to be able to have you treat live patient courses right here in Arizona. But anyway, those are three that I would look into. Implant Pathway, I'd look into the Mish Institute, and I'd also look into Dr. Arun Garg. All three of those would be great resources for sure. There's others, I'm sure, but that's where I would start.
Thank you, Gary. The second question is, I'm struggling to attract high-value patients, specifically for cosmetic dentistry. What can I do to change this?
Well, again, I believe that a good place to start would be your own practice. There's got to be patients in your practice that could benefit from cosmetic dentistry, specifically say a 8 or 10 unit porcelain veneer case. And consider my suggestion that I made in the coaching and action segment, which is identify those patients and just have a candid conversation with them. Susan, one of my areas of interest is cosmetic dentistry, and I'd love to help you have the smile of your dreams. And I would be happy to do your case for you on a special fee arrangement. So, maybe it's 50% of your normal fee. Maybe it's lab fee only. You decide. I'm not going to suggest, I'm not going to suggest how to do that, specifically. You decide. But I might say, Susan, I would be happy to do your case for lab fee only, in exchange for you telling everyone, that, or anyone that asks about your smile, that I'm your dentist. And you typically want to pick someone that is outgoing, has social contacts and social network. A client of mine did this it was his kids, 2 kids, son and a daughter. It was the kids' high school English teacher, his kids' high school English teacher, who they knew through their kids.
Right.
And a wonderful teacher, just a wonderful teacher. Single parent herself. And she always wanted to improve her smile, but she didn't have the money. She was living on a school teacher's single income, in the family. And you can imagine, Aaron, that's not going to give a lot of resources.
Right.
I personally think teachers are woefully underpaid. But my client reached out to her and said, I would love to help you have the smile of your dreams. And she said, Doc, I want to have that done. I just can't afford it. And he said, no, let me tell you how I think we could do it. I'd be willing to do this for you for lab fee only. Now, the lab fee is not inexpensive, Aaron. This was a 10-unit case. Lab fee was at that time $375 a unit, $375 a unit for lab fabricated veneer. So she was paying almost $4,000, for the lab fee only. And that was a stretch for her. But, his fee at the time was $1,500 a unit. So she was getting a $15,000 smile, for $4,000. What a deal. Mm-hmm. And he said, all I ask is that if people comment about your smile, let them know that I was your dentist. She said, I'm going to tell everybody. That's the exact kind of person that you want. I'm going to tell everybody I meet. Doctor, I can't tell you how grateful I am for you to do that. So I'd start internally. But as soon as you build your confidence with that, having a few cases under your belt and having some walking billboards out in your community.
Also, I would recommend
I'd pivot really quick over to SEO.
Right.
So comment on that, Neri. Comment on that.
Absolutely, Gary. So I was going to say that those cases you're doing, try to get some pictures, and as you, of course, with the permission of the patient, and ideally like full face pictures, because once your SEO starts kicking in, and once, we have a mutual client, he's ranking for like 100 different keywords related to veneers. And so every time you type in anything to do with veneers, he shows up, and he's in Dallas, a big city. So tons of people see it.
Yeah.
But that's just half of the equation. SEO
Well,
is
it gives you ammunition to build the website.
Exactly.
The cases on the website, the testimonials on the website, all of that. And the more of that information that you have, the more landing pages you have around cosmetic dentistry, you're again moving down the pathway of really increasing your ranking and getting on page 1. So you raise a very good point, Aaron, about having evidence that this is something that you do. So by all means, get those befores and afters. And don't let that slip through your fingers. Oh, I forgot to get the photos, forgot to get the before photos. Be sure to get the befores and afters. And use that as a way to credential yourself. And that also credentials you in the eyes of Google as well.
Exactly. And also, I think today, like, the full face pictures are much more powerful than just the teeth pictures, because then I can appreciate that this $20,000 or $30,000 is going to change my life, because I see how he was smiling or she was smiling and how bright the smile is now. And how
very often you see a difference in the eyes in those photos. The eyes before were kind of dull. And then in the eyes afterwards, they're beaming because they just literally, it's affected their entire appearance, not just their teeth.
Exactly. And also you can also come across as someone that's approachable. So doing videos, highlighting those videos where you explain things in layman's language, not scientific, not technical jargon, but just simple English that anyone can understand. So you are absolutely right. Step 1, and the most important step, is SEO. You have to dominate it, because you're going to get hundreds, thousands of people coming there every day, every week, every month. And then once they get there, then you want to make sure that in 90 seconds or less, you're going to convince them, like we touched on in the coaching and action segment.
Yeah. Well, and I'm going to suggest a resource. I think this particular Q&A segment is going to be laced with resources. We talked about some resources for implants a minute ago. A great resource for you mastering SEO, Naren, is your agency, Equa, your marketing agency, as that's what you do. You help offices master SEO to get on page 1 organically, to find the kind of patients you want. And now what we're doing is, instead of just finding patients, we're now finding specific patients that you want, that are, say, interested in cosmetic dentistry. Naren, let's put a link to your marketing strategy meeting in the notes. Naren's been kind enough to offer a marketing strategy meeting to any of our listeners, where they'll sit down in a Zoom meeting with Lila Stone, your director of marketing, and Lila will share with you how your current website is performing, good and bad. She'll show you some Google Analytics about where you stand in the eyes and mind of Google, and how you can improve all of that so you can start, in this case, attracting more patients that are interested in cosmetic dentistry. And that's www.equa.com/MSM. That stands for Marketing Strategy Meeting. That will be time very well spent. I can assure you. I know when I did mine almost 7 years ago, that was some of the most useful marketing time I've ever spent. And I couldn't be happier about our marketing results. And I'm spending less than I ever have. How about that? Getting better results and spending less than I ever have. A pretty good combination there.
Thank you, Gary. Yes, we'll put that link, equa.com/MSM. Let me ask you question number 3. I'm considering working on becoming accredited by the AACD. I know, Gary, you are a big fan. What are your thoughts?
Well, if you're interested, go for it. I love the AACD, the American Academy of Cosmetic Dentistry. They have almost a 40-year history now. They were started in the, I believe, early 1980s. And absolutely love everything about the American Academy of Cosmetic Dentistry. If you're interested at all in cosmetic dentistry, that's your tribe. That's your tribe, man. Every year, Dr. Paul and Dr. Tim attend that annual meeting. And every year they come back charged up with knowledge, with motivation, with information, with resources they didn't have. And I would strongly recommend that you work on becoming accredited. Now, the public doesn't know what in the world, being accredited by the AACD means. They don't know what that means. But by the way, it's a pretty elite group. I might have the numbers a little bit off, but I'm going to be close. I believe there's 400 some odd accredited members in the United States, 400-ish members. That would be a pretty elite group out of 150,000 dentists, 400. Wouldn't you agree?
100%.
And if you want to go even farther, once you become accredited, then you could become a fellow of the AACD. I believe that number is somewhere around 80 in the world. When you get accredited, you have to present 5 cases. They're 5 very specific cases. They're called out cases clinically. One of them is a missing tooth in the aesthetic zone that you could either treat with a bridge or an implant. Another is an 8 or 10 unit lab fabricated porcelain veneer case. Another is a direct composite veneer case, direct composite case. And there's 2 others. You take a written test, you submit those 5 cases. There's a requirement to attend a certain number of annual meetings. I believe you have to attend a certain number. I'm not sure what that is. But that would be an awesome accomplishment. The journey itself, this is clearly one of those cases where it's not just the destination. Yes, the destination of being accredited is awesome, but the journey is going to be as awesome when you go down that path. And while the public might not know what that means, you could have a photo in your office of you receiving your accreditation, at their annual meeting. Could that be, and one of your team members, when they're taking the patient on a tour, you could say, one of the things we're really proud about our doctor is she is an accredited member of the American Academy of Cosmetic Dentistry. There's about 400 doctors in the United States that have earned that honor. And we're very proud that our doctor is one of those. Now, if the patient doesn't know what in the heck AACD means or what accredited means, what are they going to think when they hear that, Naren?
I think they're going to think she is really well qualified, right?
Wow. That's often what the patient says. Wow, that's really cool. And there's your credentialing right there. But Naren, speak of credentialing as relates to Google, because it does, imagine those initials after your name.
Yes.
Like Paul and Tim both have MAGD after they have, Paul has a DDS, Tim has a DMD, but after the DDS, Paul has MAGD. Tim has DMD, and then he also has MAGD. Talk about those credentials and what it means to Google.
Absolutely. So if you want to be in the top 5%, that's getting 95% of the free traffic from Google, you pay attention to 6 things. And one of those 6 things is called Google Eat. And pretty much this is a set of standards that doesn't apply to every business owner, but applies to certain industries, healthcare being one of them. So if you're in healthcare, Google wants to know that you have the credentials to be able to talk about the topic, which is in this case, veneers or whatever the topic you're interested in, you are specially qualified for it. So having those credentials in a way that the Google bots can read and understand and see you as an expert is really critical. So in Google Eat, E stands for expertise, A for authority, and T for trust. So this affects the E, expertise. So you need to have a bio where you include what university you went to, what associations you're part of, what extra credentialing you have. And if you do it correctly, the way Google asks you to do it, there's some technical things you have to pay attention to. This can make a massive difference, not only in influencing patients, but also influencing Google, so you rank even higher.
Yeah. I wanted you to share that, Naren, because I think that our listeners may not know all the details that behind the curtain with Google, but this is an important detail in that. So not only would the journey to become accredited be a very useful process for you, but the finish line of earning those credentials will enhance your results in terms of your search engine optimization. So go for it, Doc. You'll be thrilled you did.
Thank you, Gary. I have the last and the 4th question for you. I have been an Invisalign provider for a while now, but I'm embarrassed to say I really don't have very many cases. I do about 3 a year. Can you suggest how I can grow this part of my practice?
Thank you, Doctor, for your candor and your humility in sharing that information. By the way, you've got lots of company. I can think of a new client of ours that I've started working with recently that said, I asked, can you tell me about the high value services you do? And he said, well, I do Invisalign, but I sort of do Invisalign. I'm doing about 3 cases a year. Ironically, same data, right? 3 a year. And I shared with him, I said, do you want to do more? He said, yeah, I really do love doing Invisalign, and I've got team members trained on it, but we just can't seem to get any traction. And I introduced a very simple technique, and I'm going to introduce this now to our listeners. I want you to work with your hygienist in particular, and I want your hygienist to be looking for two specific conditions in the patient's mouth: crowding or spaces. Crowding or spaces. And I want them to simply be paying attention to identifying patients that have either crowding in their teeth or spaces in their teeth. Notice what I'm not asking the hygienist to look for: posterior occlusion, canine guidance, case type. No, that's your job, doc. Your hygienist is simply looking for crowding or spaces. If they see someone there, let's say it was you, and let's say you had crowding, I'm just making it up.
Right.
And the hygienist can say to you, Naren, if there was a way to correct the crowding in your teeth without brackets or braces, would you have any interest? What might many patients say?
Of course.
Yeah, what we often hear is, yeah, I had braces as a young adult. I was supposed to wear the retainer, and I didn't follow instructions, and I stopped wearing the retainer, and I eventually lost them. And now my teeth started moving around. I just don't want to look like I'm, in middle school again with braces. So then the hygienist could say, well, we have state-of-the-art adult orthodontics. You may have heard about it. It's called Invisalign. Does not involve brackets or braces. So you don't have to worry about looking like middle school again. If it's all right with you, Naren, when doctor comes in to do the exam today, would it be all right if I had him take a look and see if you're a candidate for Invisalign? Would that be all right?
Absolutely.
Yeah. And now make a pass off. The hygienist can say to the doctor, Dr. Paul, would you do me a favor and Naren's interested in learning if he could correct the crowding in his teeth with Invisalign. Would you do me a favor and take a look and see if he's a candidate for that? And again, most of the time, the vast majority of the time, the answer is going to be, Naren, you are a great candidate for that. And now the patient's intrigued. It doesn't mean everyone's going to do it, but you just created a whole nother level of inquiry, level of interest, planting seeds. And all it took was your hygienist looking for crowding or spaces. Every hygienist on the planet is skilled at looking for crowding or spaces. And you're a clinician. You're seen as a clinician if you're a hygienist, and it's perfectly within your purvey to identify, especially crowding, Naren, because if you have crowding in your teeth, it's likely that you're not able to do a great job of home care in terms of flossing between the teeth because of the crowding. So this fits perfectly in a conversation, with a hygienist. But that's a great way to create interest, and watch what happens. So I want to leave a teaser, Naren, for all of our listeners. There's a client in my client base that was that 3-case-a-year doctor, 3 case a year. Today, they start at least a case a week, He averages about 60 starts a year on Invisalign, where it used to be 3. How do you like those results? Now, there were other factors. For example, he got to a point where his SEO got really good around it. But many of those cases are coming by just looking for crowding or spaces in hygiene. 3 cases a year to 60 a year, that's a completely different, level of achievement. And that happened primarily because of what I just shared with you about looking for crowding or spaces. Well, Naren, as we come to the finish line today, I hope we've inspired. I hope we've created some interest. I hope we've maybe gotten you to think a little bit more about an intentional practice. And hopefully maybe pique your interest in doing more high-value dentists. I'll close with one thought. People will pay for what they want often before they'll pay for what they need. Naren, what do you think of that quote?
People will pay for what they want
before they'll pay for what they need.
I think that is 100% accurate.
Yes. I've often said that quote. People pay for what they want before they'll pay for what they need. And high value services, many people want those things. They want an implant to place a missing tooth. They want a beautiful smile. They want comfortable office visits in the form of oral conscious sedation. They realize they have a lot of complications in their mouth, and they want to have a beautiful restored smile. So all those things, they want straight, beautiful teeth as an adult. They want adult orthodontics. People will often pay for what they want before they pay for what they need. All right. As we come to the finish line here, thanks, Naren, for co-hosting this podcast. Thanks to your team for all that they do in terms of helping Life Smiles with marketing, but also helping our clients master the world of digital marketing. Also want to thank all of our listeners. We appreciate each and every one of you. If you don't currently subscribe to the Thriving Dentist Show, let me encourage you to hit the subscribe button. That means every Wednesday when we upload a new show, it'll be automatically uploaded for your listening convenience, and you'll never miss a future episode. On that note, thank you for the privilege of your time. Naren and I look forward to connecting with you on the next Thriving Dentist Show.